Hello, my dog lovers and health-minded friends. I am here with two of my colleagues and friends, Dr. Linda Brent and Dr. Ruth Roberts. I'm so glad to see you here today. Hi, Linda. Hi, Ruth.
Hey, Peter. Good to be here.
I'm super thrilled because I dare to call 2024 the year of revolution and evolution of medicine in a big way, because we're starting to recognize how important animal hormones or the hormones are for dogs and cats and other creatures and humans as well. Some of you may know that we've recorded already one interview with Dr. Brent, and I have had a discussion with Dr. Roberts on other topics. And we kind of agreed that we need to talk about this topic more. And I'm super grateful for your time, Linda, and your time, Ruth. And before we start, for those who do not know you, why don't we just start with your background so everyone understands where you're coming from and what your background and expertise is?
Well, I can jump in. I'm Linda Brent. I actually started as a primatologist, worked with captive chimpanzees and baboons and other animals, and started a sanctuary that retires research chimpanzees called Chimphaven. And after that, I moved on to working with the Parsemus Foundation, and I'm the executive director of the Parsemus Foundation right now. And we cover really diverse areas of health and medicine in animals and in humans. One of our big areas of interest is in sterilization and contraception. And we've been a long-term proponent of alternatives to traditional spay and neuter. And so we're probably one of the original organizations to talk about this issue, for 10 plus years now, and really interested in following the research and the evolution of what we know about the impact of hormones on animals and how spay and neuter can change those health trajectories. I have a whole farm at home, and I love animals. I love dogs. And this whole topic goes to my heart. I mean, I really am passionate about doing the best we can by our pets of all shapes and sizes.
I thank you for your introduction, Linda. I know that you have a dog in your life that has guided you through this whole journey, and the same applies to me. How about you, Ruth? If you can tell us where you're coming from when it comes to this interest.
So I've been practicing veterinary medicine since 1990, so over 34 years, which is a little strange to say. I went into veterinary medicine as a traditional, conventional veterinarian. About 2005, I started studying Chinese medicine, acupuncture, herbals, food therapy, and then later functional medicine. But along the way, what I noticed was as we worked on controlling the pet overpopulation problem, all of a sudden, in the, I would say, late 90s, early 2000s, I was seeing cancers, chronic disease, proportions that were totally bizarre. I did not understand what was going on. So this has been a lifelong passion of mine since the majority of what I ended up supporting patients with was chronic disease and cancer. And later, once I sold my practice, doing consultations on the one-to-one consultations with pet parents and also training people to support pet parents. These are the things that we're dealing with in truly epidemic proportions. And it makes no sense until some of the research started to come out. Mm-hmm. So, the very early papers from UC Davis back in 2013, just looking at case records of golden retrievers, and lo and behold, the intact Goldens by and large were much healthier than the spayed or neutered Goldens. So that's where I was like the aha moment. Oh, this is what we're dealing with, are animals with endocrine systems that have never been competent.
I like you're saying that it just didn't make sense to you. And that's exactly where I was when I started looking into or searching frantically almost for options for my dog Pax, who basically was healthy, grew up super strong. And I was thinking, okay, I've got it dialed. Like I had a dream of raising an amazingly healthy dog. And then he got neutered at 18 months, so relatively late, and he was already strong and so on. And pretty much within 3 to 6 months, he started getting injured himself. The first time I actually started seeing him limping, interesting enough, was when Dr. Becker and Rodney Habib visited Prague and we went for a walk and he hopped out of the car and started limping. So it's almost like he carried a message for all of us. And so then it took me about virtually like 2.5 years to figure it out. And it was physio and chiro and needle therapy and nutrition and supplements and everything. And nothing really worked. And I felt like a total failure, number one. Number two, I was super sad and down and at times depressed about seeing my young dog actually limping and not being able to do what we love, swimming and running and hiking in the mountains. And then I was very lucky to run across the studies from your organization, Linda, Parsemus Foundation, and also Dr. Michelle Kutzler. I was really fortunate and lucky to come across this information because you, Linda, convinced me that I should not be worried about doing hormone replacement therapy for my dog. So we started him on the regular protocol, which we actually going to mention later. And pretty much within 3 months, I had a brand new dog. And the number of times people ask whether he's a puppy now is absolutely astonishing. It doesn't happen once or twice a day, but several times a day. And his coat has exploded. It's beautiful and shiny, and he's strong and happy. And there's a whole kind of array of changes from him being happy, but also not as fearful and afraid of things, not as sensitive to noises. His spine and his muscles just almost like miraculously kind of dissolved into this flexible, beautiful. I can't even describe how amazing it is to actually observe the changes. So when I started seeing them, I felt like I can't really stop now. I have to share this with everyone else. That's why we are here. And that's why I know that we all are determined to share this information and make it really happen. And I think 2024 is a kind of like a breaking year where people are starting to get it and talk about it. It may be also in light of the human hormone replacement therapy, correct?
Well, two things. I think there's human hormone replacement therapy, and especially using bioidentical hormones, has become more popular. And this is when I couldn't find answers on the veterinary side, I started looking on the human side because there's research there. And there are a couple of interesting things. One is for women, if we have an ovarian cyst that looks a little suspicious, unfortunately, the cancer screening tests are not very good. And so the standard operating procedure is to remove both ovaries at the same time. Well, I was in this position. I had all the right risk factors to have ovarian cancer, which is just hideous. So I did a lot of research, and there was a paper that had just come out, and it said that if you take both ovaries from a woman before the age of 64, you will take 4 years off of her life, all-cause mortality. And I had to send my OBGYN the paper to really convince her to leave the left ovary. And the interesting thing is that she told me is that, and this is sort of a segue, but ovarian cancer is actually coming from the fallopian tubes, not the ovaries. So she did take both of those. But that was like, holy smokes. And by 64, most women have been in menopause for at least a decade. So it's not the menopause that reduces their lifespan. It's taking the source of the hormone production, even though it is diminished, away from them. And so that really codified to me, what have we done to our dogs? What are we doing to our dogs?
Linda, I know that you also have a personal experience, that you have one teacher in your life, similar to Ruth and I. What prompted you? Like, what happened?
My dog's name's Toby. I mean, my attachment and relationship with him is very much like yours is with Pax. I mean, he's my best friend, you know? And we picked him up at the pound. Of course, they force you to get him neutered. And at the time, it was a long time ago. He's 8.5 now. Kind of before I was aware of some of the issues with spay and neuter. Got him home, and seriously, within a couple of months, he was a mess. Mm-hmm. He was a happy little puppy, running around, sociable, fine. And over 3 months, he just got worse and worse. He gained a lot of weight. He was absolutely petrified of every person. We couldn't take him anywhere. We couldn't take him out of the house. And the worst part was he started having serious mobility problems, kind of focused on his hip, but he couldn't. I mean, people don't think about this. Here's a, 1.5-year-old dog who can't run. He can't jump up. He couldn't get on the couch. He couldn't play, really. And so we tried everything. I mean, I'm not a veterinarian, so I was working with my veterinarian, from supplements to psychotropic medicine to, whatever. And he basically was on pain medicine. And what really got me was when we got another dog who was a little bit, they were a couple years difference in age, who wanted to play. He wanted to do something. He wanted to play. And poor Toby he couldn't. He couldn't do anything. He just sat around most of the time. And of course, that didn't help with his weight problem. So luckily, because of my job, after trying a lot of different things for 4 years, we kept trying to see if we could help him. I got in touch with Michelle Kutzler and said, look, I'm thinking this is what's wrong with him, that this isn't just a joint issue. This isn't just, you think of cancer, you think of joint issues for dogs that have been spayed and neutered, right? Those incidences are more common, but his was really diverse. And so I started talking to her, and she helped me through the process of working with my own local veterinarian to get him on testosterone therapy. Being a scientist, I took all sorts of data throughout the whole thing so that we could record what was going on. And his transformation was absolutely amazing. Absolutely amazing. I've never seen anything like it. You have.
This is the thing that what I love the most is that our dogs are determined to be our teachers.
Yeah.
There's no doubt. Like
Absolutely.
on the universal scale, I'm kind of convinced that dogs are on some level more evolved species, or that they're messengers for us. And our own body as well is teaching us, in case of Ruth, obviously, and our own experiences are the most powerful. But it's so interesting how we kind of go through life and think that everything is set, and not suddenly we have an experience that completely shatters our preconceived ideas and beliefs.
Yeah.
And we need to either shift or
suffer.
And the other thing is that this is actually the crossroad where humanity and people either choose to kind of defend their preconceived ideas in the status quo, or shifting and saying, oh my goodness, I've been wrong. How can we actually correct it? Or this is pretty clear. I think that this is what we are dealing with right now, that when something like that happens, when an earth-shattering experience happens, there is no doubt that we actually shift more likely. Even 5 years ago, I already had a little interaction with an unknown entity, a rescue shelter, who insisted that a dog that had neurological tremor would be neutered at eight weeks. And I basically asked them not to, and they threatened the dog to be repossessed from the client, from the potential parent who was adopting the dog. Already 5 years ago, I was getting some messages from the universe, this is something that you really have to look into. So, Linda, because you're an expert in, and you kind of participated in some of the primate studies and so on, can you give us an overview, simple overview of the hormones and how they work? And we can kind of have a little roundtable
Sure.
about that.
I think it's important that people realize how critical the hormones are. Your body is like a finely tuned machine, right? If you mess with one little piece of the machinery, things are going to break down the road. And that's exactly what happens when dogs are spayed and neutered. So a spay or neuter, as we think of them, is removing the gonads, which are the sex organs. It's going to be the ovaries in the female. Those are what produce the hormones, or the testes in the male, and those produce the hormones. So how that works is the control system is really kind of a circular thing. So you've got organs in the brain. You start with the hypothalamus, and it produces something called gonadotropin releasing hormone, GnRH. And that moves down and affects the pituitary gland, which is actually a gland near the brain as well. And when it's stimulated, it produces luteinizing hormone. Luteinizing hormone then gets into the circulation and goes throughout the body. It affects a lot of parts of the body, but it specifically stimulates the sex organs to produce sex hormones, testosterone, estrogen, progesterone. You have this whole system, but the key of it all is that the sex hormones obviously circulate throughout the body and into the brain, and the level, whether they're high or low, impacts those brain organs to either produce more GnRH, more LH, or less, depending on the level. They call it a feedback loop. So when your hormone levels are adequate for your body, it doesn't stimulate the brain to push more of this system around in a circle. If it's too low, then it stimulates the brain to make more GnRH and then make more LH and then stimulate those sex hormones again. So you can imagine with a circular system like that, with a really elegant feedback loop, which many parts of our body work that way. If you take out the sex organs, what happens is there's no feedback to the brain. The brain thinks, oh my gosh, there's no hormones. Push. We need to keep pushing to try to get the hormones going. So what ends up happening is you get these big pushes of GnRH on the pituitary gland, and the pituitary gland just goes crazy and starts making lots of LH, luteinizing hormone. And so it totally imbalances your hormone systems. And so, I mean, really, when you think of it that way, there's no wonder that many things in your body can get out of whack when you remove that natural hormone system.
Ruth, I felt like you wanted to say something.
Yeah, and this is the thing that, and I know maybe we're diving into it now, I don't know. But at any rate, it's my understanding as well that when that feedback mechanism is removed and then the levels of luteinizing hormone increase, we can see increases anywhere from 3 up to 30 times what it would be in an intact animal. And as Linda said, there are receptors everywhere in the body. So I think the jury is still out whether there are more receptors induced or simply because there's so much luteinizing hormone, then the theory is that this begins to change the way that the cells do their actions. So whether that's for producing a specific protein, being a chain of mechanism in a specific set of actions, the consequences we end up seeing body-wide are just horrifying. And so, as you've both said, both of your dogs experienced anxiety, fearfulness, and things of that nature. We know there are LH receptors in the brain, so that's going to change. We know there are LH receptors in the gut where the vast majority of neurotransmitters are produced. So it's no wonder that the experience of anxiety and fear and phobias within dogs have escalated dramatically since the mid to late 90s into the 2000s. And that's when drug salesmen started coming in with branded versions of old human psychiatric medications for dogs because the level of separation anxiety and phobias and fears had just skyrocketed.
I'm kind of blaming myself a little bit for not cluing into the importance of sex hormones in our animals for such a long time because, we talk about insulin, a super important hormone metabolically or for life. The same for thyroid hormone, super important for metabolic rate and just basically oxidation and breathing of all the cells. And we somehow forgot that the sex hormones are not just for reproduction, that they're actually super important in healthy metabolism. And that's something that is now so clear, but I didn't understand it. And, going back to humans as well, when you look at women and men, women obviously go through menopause at a certain point of their life. And so those symptoms are often talked about more. But when you look at men and their transition to older stage, they call it andropause now, you start seeing these grumpy, possibly depressive, and not very nice people to be around. And that's the hormone absence in men. I think that there are so many glaring examples of that, but we just didn't really see them. And that's the interesting part, but also encouraging part that now we know. It's like we've been walking around with blindfolds on.
Well, and that's part of where functional medicine was very useful to me to start to understand the problem. So I did some training with Institute for Functional Medicine, and these are issues that begin to start in their 40s and 50s. And so they're going through this list of things that are a problem. And I'm thinking to myself, oh, I am treating this every day in my practice.
Mm-hmm.
So it got crystal clear fairly early for me that we'd really, in trying to solve one problem of overpopulation, we chose one method. And I think that's something we'll speak more about, to solve the problem instead of looking at the impact of that solution and looking for other solutions.
Linda, can you take us through some of the studies and tell us, just kind of review what the findings were? I know that Dr. Michel Katzler and you have collaborated for some time, and I believe that your organization sponsored some of the research. So can you tell us more about what is already given and what is determined and what your plans are as well?
I guess there's two areas that the Parsemus Foundation has worked specifically in. And one is kind of going from what Ruth said, what's the next step? I mean, everybody who got pets and spayed and neutered their dog did so because they cared about their dogs, right? They wanted to make sure they weren't reproducing uncontrolled. They thought this was the best thing. They were told this was how you be a responsible pet owner. And I think that whole issue of choices didn't come up. It hasn't come up very much, at least in the United States, where there are options that are available to sterilize your dog without affecting hormones. We call it hormone-sparing sterilization, which is a simple vasectomy or a hysterectomy in a female, where you leave the sex organs intact so they can continue producing those important hormones. And the reason that we're so engaged in that is because we have known and been following and advocating, educating people about the studies that were coming out since over 10 years now. Most of the early studies were comparing intact dogs to spayed or neutered dogs.
Mm-hmm.
And a lot of the early studies didn't have a lot of control over like when were they spayed and neutered, which now we know makes a big difference. And the research over this time period, in my opinion, all of the research coming out is supporting this idea of the importance of natural hormones. It's probably going to take a long time to like really tease down into some of the fine details, but we already know, I think, that there needs to be other options besides spay and neuter, especially early age spay and neuter. I think you could say pretty clearly that joint issues are a huge problem when dogs, especially those that are spayed and neutered before they've finished growing, which for a small dog might be a year, less than a year, but for a large dog, it could be 2 years. And so joint issues, hip dysplasia, CCL tears, elbow dysplasia, those kinds of things are much more common in a lot of breeds, especially larger breeds that grow more slowly. And then, as Ruth said, cancer. I mean, what could be worse than cancer? I mean, I'll tell you that I had my experience with Toby, but the dog I was mentioning that we got as a puppy was also a rescue dog. And they played together, and that was my dog Blue. And he died at 5 years old from lung cancer. We did everything we could. And after surgery, he died within a month. It was already metastasized at 5, which is unheard of. But of course, he came from a shelter and was neutered early. So cancer is just a devastating disease. I can tell you, it's one of the most awful experiences any pet parent can go through. And it's more common in many different breeds after spay and neuter. And lots of other issues. People think it's a great idea for behavior to spay and neuter your dog. Like they'll be better behaved. Well, that's not really true. I mean, most of the better research, the more recent research is showing that a male who is neutered is not going to perform the kinds of behaviors that are related specifically to sex hormones, like seeking a female. He's not going to be interested in doing that. So roaming might be less, urine spraying might be less, but not all the time. So females wouldn't be maybe as receptive to males, are interested in that, of course, if they've been spayed. But in terms of aggression, a lot of people get their dog castrated because they think that'll reduce aggression. That's been found to be not very helpful. In fact, it can be harmful. It can make matters worse. Endocrine problems, hypothyroidism, insulin problems. There's so many parts of your body that, like we mentioned, that are dependent on those hormones. And when you take that out, it can cause problems. And, not every dog is going to have that problems. I've had rescue dogs before and they were fine. But now that I know all of this, to be perfectly honest, when I look back, I think, oh, I had a dog a long time ago who definitely got dementia in his older age. That's one of the symptoms of not having hormones as well. So I think some of the difficulty in terms of the research in understanding this is just because, just like in humans, it's very complicated. And there aren't nearly as many people studying this in our pets as there are in human research. So we do go back to human research and look at that and try to understand what do we know in humans and how might that cross over to what's going on.
It's interesting you're saying that now looking back, you're seeing things differently. And that's exactly how I see things as well. And I'm quite certain that Ruth, you will have some examples of that too. My general experience in the past was that dogs got old, middle-aged dogs started getting stiff, their back started going, and we kind of assumed that that's age. But now when I'm kind of looking and seeing, and even going back with my previous dog, Sky, he lived until he was 16, but he was not perfect on the level of mobility. Like he had, constant back issues. And I used to go to chiropractor and we did acupuncture and different therapies and rehabilitation. And I think that he would have been much better and much different as well. When it comes to my perception of where this deficit of hormones actually plays a role, pretty much anywhere where the receptors for 2LH are. So it can be the gut, it can be the skin, it can be the ears, it can be the liver and kidneys, the heart and all that. So I think there's really a lot of research needed to be done. But I suspect, based on what we already know and the changes that we are seeing, every single part of the body is related to each other and the hormones go to all these different cells. So it would be really surprising if they were not affected, if there was some sort of selective effect of the hormones on the body. I find it interesting to see that when you start kind of opening your mind, that the cases and the examples start coming. One of my team members has a golden retriever who had basically pretty much identical symptoms to my dog Pax, except he tore his cruciate ligament. We were not able to prevent that because he basically did not get on the hormones early enough. And just today, as if the universe knew that I was actually going to talk to you, I ran into a lady in the park who basically, she had a little Jack Russell and we started talking and Pax was playing with him. And she also was talking about an injury and that is not healing. And not only I gave her the information on hormone replacement therapy because the dog was neutered at the age of 8 when he was rescued in a shelter, but I also knew this lady from my childhood. And when I gave her my name, I realized that I knew her 45 years later, something like that, even more. So that was really interesting. And then I had a person from the building calling me about a rescue dog that was rescued in Asia. And this dog was neutered without their permission somewhere when they were adopting it. And basically, they took the dog and neutered it or spayed it. And unfortunately, this pup has cancer right now. And I know that there's going to be a lot of kind of like back and forth between rescue organizations and shelters to say, well, this would be irresponsible to actually spare dogs' hormones. And they immediately assume that we're saying, do not spay, do not neuter. But as you're saying, there are alternatives that spare the hormones. And this is what we need to emphasize, because if people realize that we don't need to get rid of our objective to prevent overpopulation and homelessness and still keep our dogs healthy, I think that this is the main point that we want to make, right?
Yes. And I think Linda's brought up already ovary-sparing spay and vasectomy. Unfortunately, there are not very many veterinarians that are trained in these techniques, although, frankly, I don't know, they're not that much more difficult than doing a regular spay or neuter. But there are other options beyond that. So including, waiting and delaying. There, outside of the US, there are implants of a gonadotropin releasing hormone inhibitor that will prevent fertility But in both of your cases, it can be used to actually support a dog that is experiencing symptoms of what I am calling spay neuter syndrome, just because I feel like we need to put a label so that we can have a more cognizant discussion about what's going on. And the race is on to find a permanent way to prevent unwanted pregnancies and breeding that involve an injection or some other procedure that would last a lifetime. So there's a lot of options that are out there in the world that are being studied and developed. And it's a matter of what's going to be the most cost effective in terms of reaching a broad spectrum of animals. And then also, I mean, they're, doing these surgeries are not without peril as well. While the percentages of complications are quite low, if there are other ways to support preventing pregnancy and unwanted puppies in dogs, then this is going to be a much better, much more efficient solution.
I actually believe that, or started to believe, seeing all the different cases that are clearly affected by lack of hormones. It obviously does matter if a pet is neutered at the age of 8 or 12 weeks or six months or 2 years. But I think the consequences are eventually very similar, even though they're not as deep and profound for the older ones who get neutered later. When it comes to, affecting hormone reproduction, let's say by an injection or some sort of depot and so on, I'm a little possibly more worried about the impact of some sort of birth control for dogs. Ideally, if people can be responsible, and I'm going to say that because that's what I believe, not spaying and neutering our dogs would be actually the best way to go if we can be responsible. But I also understand that shelters cannot really release a whole bunch of dogs that are unspayed and neutered and perpetuating the problem. So I'm very happy to settle for the middle road and say ovary sparing spay and vasectomy. I know that there were some other ways of kind of making dogs infertile, as you say, the depot suprelorin, but it does stop the testosterone production. So in unneutered dogs, it would actually have the counter effect. In neutered dogs, it actually neutralizes the luteinizing hormone, and then we just need to supplement testosterone. So it's an interesting one, and we'll share the protocol with everyone through a link and in the description notes. But it's going to be an interesting discussion, and I'm sure that it's not going to be all the same, and there's going to be several different options. But if we address the main issue, and that is the absence of hormone causing health issues and problems, then I think that would be fantastic, and that's what we are hoping for. Linda, what is your take on this?
The whole process of considering how and if to sterilize your dog should be individual. I really, really encourage people to work with a veterinarian who is knowledgeable about options, different options besides gonadectomy and traditional spay and neuter. Look at the risks, look at your lifestyle. As you said, you kind of hope that everybody is a responsible pet owner, but there's a continuum. I've lived in different parts of the United States and there's definitely cultural differences in how responsible you are with your pets. And so I think that as people understand there are options and as those options grow, I think Ruth is exactly right. In the next 10 years, there's going to be some real revolution in sterilization methods, I think, for animals. And as those options grow, then just kind of changes the way we think about that decision. It isn't a one and done. It's an actual decision based on lots of factors for the best interest of the family and the pet. Mm-hmm. So I like the idea that people have options. For me, I have a new dog, a little beagle, and nothing's happening to him. I mean, he's going to remain intact for his life. It's no problem. His behavior is perfectly fine. We have a big fenced yard. So for us, that works. So I think that is the easiest option probably for a lot of people that have their pets in situations where they're not loose or free roaming or any other issues that could happen.
One of the things I think that is important to realize is that there is a protocol that Linda has worked on through the foundation and that Peter's been able to use for pups and has been very effective for their own dogs plus many other dogs. But not every veterinarian is open to having that conversation because it does involve using testosterone for male dogs, although we can talk about it for female dogs some other day because it is a controlled substance. So it is FDA approved for use in certain situations, but because there's a lot of bad press about testosterone, many vets are unwilling to open that Pandora's box. I think it's critical to remember that there is a potential solution, but not every veterinarian may be willing to implement this. The other thing that's critical to remember is that in biology, in our physiologic existence, one parameter is never in isolation of other parameters. And what I mean by that is all of the other things we have all been talking about, the quality of food, the level of toxins in the environment, all of those contribute to an individual dog's experience of life and can either not be a big deal if the pet parent is really, really cognizant of these issues and controlling what they are able to control. But if the average pet parent is not cognizant and the dog has been spayed or neutered quite early in life, along the lines of 8 to 12 weeks, these things can compound the entire problem for that individual dog.
Yeah, I think that you're onto something because I've heard from some of my clients and friends that some veterinarians are really afraid of using testosterone. It just kind of dawned on me that it's not only hormones that are problematic, right? It can be pain control, opioids, and so on. And we don't just say, okay, we'll let people suffer in pain just because opioids are a controlled drug. They're a controlled drug, but they're also very important. And when it comes to testosterone, number one, there has been a little bit of a negative rap because of bodybuilders and the abuse. But these doses are very different. They're much lower. They're given once a week. If veterinarians are really that worried that people would abuse the testosterone, why don't they just invite or have a Wednesday, testosterone Wednesday, and all the dogs would come for a 2-minute injection and it would be all fine, right? Or technician can administer it and it's all controlled by the logs and information that has to be entered in the log. So it's not doable. There's another problem, and that's the suprelorin. And suprelorin is, I'm just going to simplify it, it's more complex, but it suppresses LH production, not the end result. And that medication is available in Europe, it is available in Canada, and it is not approved for dogs in the US. So that's another thing another obstacle. It seems that the United States have unfortunately created all these obstacles for us to get the results. But we are hoping that as time progresses, that even Verbac and the organization or the company that makes the medication will recognize that this is super important. Linda, can you please explain the treatment? We all are familiar with it, but just because you're so good and eloquent in explaining that part, why don't you just take us through the program?
The concept that we used was really focused on what's going on in human medicine. And there's a lot of information on supplementation of hormones for humans for multiple reasons. When I was scouring dog literature, to be honest, there was really nothing. One study that was done using a monthly bolus in male dogs to treat incontinence, which isn't as common in males as it is in females. And then some research where they were, not studying the dogs, but using them as a model to study effects of testosterone. So really not much out there. But from the human literature, if you're doing an injectable, which is honestly the easiest thing for testosterone in male dogs, because a transdermal, they don't have much open skin surface to rub anything on that they wouldn't be able to lick. And we actually tried it on Toby inside of his ear and it made him nuts. He just always was rubbing his ear and trying to scrape it off on the ground. And I said, well, that's not going to work. So we started with a monthly dose with Toby. But what we found, as you might imagine, if you put a whole bunch of something into the muscle, not only is it a more painful injection, but it causes a big increase in testosterone and then a big drop in testosterone over the month period. So we immediately went away from that and started weekly, which is actually much more common. All the literature out there now in humans is weekly or even maybe every 2 weeks, but but it's much better. And you get a much more stable level if you go with something that's a shorter duration and less amount. And so that's what we used with Toby. And we were able to keep his testosterone level within the normal range for an intact dog. That's the goal. We're not making bodybuilders out of them. We're trying to just put them back where they would be if they weren't neutered. And so we were able to keep him within that range consistently all the time that we measured it. And it's 0.5 milligrams per kilogram per week, which is a tiny insulin needle. They don't even really feel it. Just to clarify, Toby's been on that protocol for 4.5 years. Absolutely no side effects. He's never gotten worse. It's been great. He still runs around and acts like a normal dog. So that's the protocol that we've been using. And I should mention, again, our goal at Parsemus is to make sure that people understand the science of things, what's out there, what are the facts that we know, but also to push that forward. We fund a lot of research. So part of what we decided to start with is to move along with the testosterone track and complete a safety study. And so that's done. It's very basic information about dosing and we did a lot of analysis of blood work and, all sorts of parameters were measured. All the hormones were measured over time. The one thing I would mention, Peter, which I haven't even talked to you about, is looking at that data. It's really clear that it takes about a month for the testosterone to kind of get to a point and level out. And also a month or even a little longer for LH to come down only on testosterone. We did a study with the dose I just mentioned, and then 3 times and 5 times that, just to make sure that if somebody accidentally gave too much, we understood if there were going to be any repercussions, and we saw no problems even at the 5-time dose. But it took that much to really see LH coming down very much. And that's the reason that often you're going to need, if you decide that this is the right method for you and you work with a veterinarian who's knowledgeable about it and working with you to look at your hormone levels and measure them over time, that you might need to still reduce LH after your dog has even been on testosterone. And that's where we keep coming back to talking about a LH reducer. The suprelorin is the one that's on the market. My recommendation in terms of a protocol is to start with the testosterone. Make sure you get some baseline measurements of LH, start with testosterone, leave your dog on that for a little while, and then start looking at LH to decide if it still needs to come down. It's all over the place. Every dog is very individual. We had dogs, Ruth, you would be surprised, in the study, their LH level it's normally supposed to be, for a neutered dog, 10 to 20 or something like that, 150. I've never seen nobody had ever seen levels that high. And this is in a very controlled setting. So yeah, it's all over the place and every dog's going to be different. So my dog, Toby's, was over 80. So that's like almost 10 times in the normal range for a dog.
So I think that it can generate a little bit of confusion here, because I know that some dogs can have high levels of LH despite the fact that they get testosterone. So starting testosterone, then measuring the LH, and if it's still abnormal, then basically opting for suprelorin to reduce the LH may be the way to go. Based on what I know, Linda, the testosterone analog that we use to supplement sometimes is not recognized by the body, and that's why the LH is still high. Is that correct?
It's definitely recognized because the testosterone can still bring the LH down. It usually does. It depends on the range that your dog is in. So some dogs, it might bring it back down to the normal range, and some dogs it won't. That's our understanding. It's very early in this area of research, though.
So it is super important for us to have 2 control groups and just kind of have one on testosterone only and one on testosterone and potentially suprelorin, right? And also observe the changes in the physical difference. It would be lovely if we didn't need to use suprelorin, because again, that's not available in the US. And based on what you're saying, it is still beneficial to use testosterone only for a number of reasons, and then just kind of check.
One thing that's useful to think about as well on the human side, the individual variability of the needed dose to achieve effect is massive. And so testosterone is used for both men and women. But for instance, one woman may take 2 milligrams twice a week. That's great. Another woman may need 6 milligrams 3 times a week to achieve optimal levels. So I think that's part of the other thing is like we want to put it in a nice, neat box that this is the dose, but this is another situation where the dosing is incredibly variable, dependent upon that individual's physiological behavior, so to speak.
I'm sure that it's true, like for almost any medication, right? Even though doses are determined. But I must say that the 0.5 milligram per kilogram works for PACs beautifully. And I give it under the skin subcutaneously. Linda, do you give it intramuscularly or under the
No,
skin?
just subcutaneously.
Yeah, because, the research says now that intramuscular injections are not needed. So
Yeah.
females, I know that it's a little more complicated, but maybe not. Mainly because I talked to my childhood friend who is now a reproduction specialist for humans and also endocrinologist. And I talked to her yesterday and asked her about hormone replacement therapy in female humans and in women. And she basically said that most of the time, the hormones, at least in Europe here, are replaced just by giving estrogen. And she herself is my age, so she's taking estrogen as well. And she has a skin spray that she uses, and she uses it daily. I asked her whether there is any need to kind of mimic the reproduction cycle and the hormone fluctuation during the cycle. And she basically suggested that it doesn't look like it's necessary. How is it in dogs, in female dogs? Can you tell us a little more?
The research on female dogs is mostly focused on incontinence because that's such a common problem. And there are medications available, you can try a number of things that are estrogen or estrogen-like products. Estriol is probably the most common one. That's usually what's going to be recommended. And my understanding is we haven't done research with females yet, but my understanding is that it's just given all the time. There's not any kind of, idea to make it cyclical, which of course the female dog cycle isn't the same as a human. So
the question is whether it needs to be given daily or once a week or something like that. I remember that, and I'm sure that Ruth, you have had many incontinent dogs in your practice. I remember that we used to give it as needed, right? The medication dosing was established by the symptoms. But what do you think? Do you think that we should be if we are to establish a study, do you think that we should go once a week? Or I'd be kind of starting maybe once a week. What is your opinion?
I think that there's a couple of things to consider. So, in terms of resolving incontinence symptoms, the estrogen compounds, we could often give them once a week to resolve the symptoms. But did we resolve the other physiologic implications of having elevated luteinizing hormone? The other thing I think that bears mentioning on the human side is that in the US, and especially in terms of research of bioidentical hormone replacement, there is the usage of estrogen, progesterone, and testosterone for women. And as you age, estrogen may drop out, progesterone may drop out, but testosterone can still be used to help maintain muscle mass, feeling good, cognitive impact, all of those things. It would be an interesting thing to study. How much benefit is estrogen? Do we need to emulate the cycle? Certainly not, because otherwise the weekly doses of an estrogen compound for incontinence wouldn't be happening. Could we do the same thing with testosterone injectable? And in fact, that's what I'm using for my own dog for Hayo. And what I'm starting to see, because we started to use this in veterinary medicine for osteoarthritis and for the frailties of aging. That's what the FDA has approved the use of those drugs for in the United States. And so she definitely qualifies on both of those counts, and it is beginning to make an impact. And I think, what Linda's saying is absolutely correct. It may take 30 to 60 days to achieve a steady state of dosing to where you can see, yes, this is going to really be of benefit, or maybe this dose needs to be bumped up, or maybe it's too high for this individual dog. So again, I think that, we want it to all fit in a nice box, but we have to kind of take into account the needs of the individual and be able to adjust based on the end result, which would be the stable level of whatever hormone we're trying to achieve.
I think that it would be interesting to see what the difference is between dogs that are only on estrogen and then estrogen and testosterone. Also measuring the luteinizing hormone in the course of the treatment and see whether we need to neutralize it with suprelorin or not, right? So I think the studies are becoming clear, the studies that are needed. And then obviously the incidence of different conditions in females and males, the ones that have HRT, hormone replacement therapy, and those who don't. And is there a difference between the genders? Meaning, do females suffer as much from cruciate ligament tears or hypothyroidism or certain type of cancer without and with hormone replacement therapy? Linda, is there anything that you'd like to add to this particular part of our discussion?
No, I really appreciate the comments, especially Ruth mentioning testosterone for females as a person, a human gone through menopause and on hormone replacement therapy, including testosterone. I can appreciate how important that is for us. So I think there's a lot of research that needs to be done in females because there are options out there specifically for incontinence. I think it makes it a little easier to work with veterinarians, to work with own dogs that maybe we can follow or get information from. To be honest, it's just a lot of basic research needs to be done on this entire area. And I think that is not only important so that we know more about treating dogs that are already spayed and neutered, but to give veterinarians the tools they need. They don't want to try experimental things on people's dogs, right? They want to make sure they understand the impacts of all the variables. And so I think it is important. It's medicine. We need to make sure that research and basic science about all these questions we just talked about are out there. So a lot to be done.
I find it challenging to see that there is so much resistance to it. And as I said, if there's a personal experience that is undeniable, then if you're integral, you can't really go any other way. And none of us have been planning to be engaged and involved in this particular topic. It just kind of happened. And we don't have any particular business interest in that, right? Like you, Dr. Ruth, do your nutrition and your consults and so on. And you, Linda, work in research, correct? And I make supplements and nutritional supplements and help dog lovers on that level. But we did not really expect that hormone health is going to be part of our interest and mission, but it's just so important. If anyone who is involved in rescue and shelter work is listening, I just want you to understand that this is not to discount the invaluable work that everyone is doing. It is only to say that we really need to change our ways. And I hope that we will get more connections and we'll be able to talk to shelters and SPCAs and humane societies and just to kind of have a friendly conversation. It doesn't need to be black and white, and it's never black and white. And we just have to have a conversation. We should not be making it a political issue either. Ultimately, our dogs are in the center point and our cats as well are the center point. But with cats, it's a little more difficult even because, I don't even want to go there because they obviously like to roam and do that. Is there any solution for cats, even though we're talking dogs today?
You could do the same thing, do an ovary-sparing spay and vasectomy or for the male cats. The difficulty for female cats, of course, is that they are reflex ovulators and they actually can become quite ill if they do not ovulate in terms of secreting so much estrogen that it can create some bone marrow suppression.
Right.
But they're sort of last to be included in most of the discussions about dog health because they tend to be less challenging in terms of the chronic health conditions they're showing us, although their incidence of chronic disease has escalated massively as well.
I know that there's a lot of work to be done, and I'm also hoping that we'll be able to encourage our community to connect with us, ask questions, and hoping that we will be also able to fundraise some funds for the research that is needed. Obviously, Parsemus Foundation is one of the organizations that people can donate. And we also would like to invite everyone to donate through our donation platform. All the money will be used for the research and education, and we hope that you'll participate in that. Linda, how can people donate to Parsemus?
It's easy. Just go to our website. We are a nonprofit organization. It's parsemus.org. We're a very small foundation, and there's very few people, as you can imagine, doing the kind of research that is needed to kind of push this field forward. So we're very interested in continuing to study the impacts and methods of hormone replacement, like testosterone therapy and estrogen therapy for female dogs. So we'd like to continue doing that. We just finished up a study on the safety of testosterone therapy, and that those results will be coming out soon. It was very favorable overall. We also spend a lot of my time at the foundation is just on advocacy, getting the word out about everything we're talking about here. And we talk to lots of people. If you want to email us, anybody can email us, and we will do our best to put you in contact with resources that will help and information that can help guide you through the process of dealing with your own pets.
I'm quite certain that there are people out there who have dogs who have gone through everything, all the possible treatment. When they get their LH test done, they'll see it high up and they will want to do hormone replacement therapy. And it would be really interesting to organize or set up some sort of system where the veterinarians who are interested in hormone replacement therapy to actually share their results and gather more information, because if we set it up right, we can actually get the information fast. And, within a year or two, we can have a lot of data that will be really helpful and useful. So if any veterinarians are watching today, any colleagues, I would really love you to connect with us through the website at peterdubias.com or at parsemus.org. Thank you so much. It's been such a great conversation. I am so encouraged by the development, and it starts slow, but then it's like an avalanche, and I'm hoping that we'll be able to make a difference. And thank you, Ruth, and thank you, Linda, for being here today. We'll keep going. This is not the last time, I hope.
Absolutely not.
Thanks so much, Peter.
Thanks.
Thank you.